So, what we have here in Yale New Haven Hospital, Abe, is we have an internationally known hospital, healthcare center, teaching hospital, etc. So why don't you give, and we're here in Connecticut, and
Yes.
really the dominant players, I believe the dominant players in Connecticut are Yale and the Hartford healthcare system for, I think, fairly close.
That's a very good
Fairly
assessment.
representation.
I think so,
Yeah.
yes.
So, but give us a general outline and overview of Yale New Haven Hospital.
So Yale New Haven Hospital is, from a licensed bed perspective, is just shy of 1,000 beds. It's located in center of New Haven, Connecticut. It is the teaching hospital and the primary teaching hospital for Yale School of Medicine, Yale University. Been around for a very, very long time.
Long time, maybe.
Long time. I think just before I was born, actually. Maybe many years before I was born.
Did I read somewhere it was like 1862?
That's
Is that
correct.
right?
Yes. So it's one of the oldest hospitals and has gone through tremendous transformation and evolution and revolution to get to where we are today. It is a unique place because it serves both a local community, a statewide community, and a national and international community. And because of its relationship to the Yale School of Medicine, there are some unique features in it, some unique academic medical center features in it.
Which are?
So, cancer, we'll talk a little bit
Right,
about
we'll talk
that
about that
in
separately,
a bit.
right.
Significant work in heart, significant work in stroke and neurology and neurosurgery, urology, orthopedic medicine, lots of areas where cutting-edge, new discoveries, because of the relationship with the School of Medicine. We always talk about from bench to bedside. It's one of the unique features. We all know Yale University and Yale School of Medicine has incredible basic science. You combine that with a place like Yale New Haven Hospital, and a combination of research and clinical care coming together gives it that very unique.
Okay, so let me draw an analogy to the business world, not of the healthcare world. I mean, in my world, coming from aerospace, it would be like drawing the analogy, Abe, of in engineering and pre-development doing a lot of R&D, which would be the medical school, the science part of it that you're talking about. And as the research is being done, and maybe there's pre-production stuff, as I would call it, it winds up going into the medical school itself where it's applied. There are applications to the research and development. Is that an oversimplification?
No, that's a great, whether it's oversimplification or exactly the way it is, that has a lot to do with how it's formed. And when you have a platform where basic science is being worked and discovered, and then you have a place where you're delivering the end product of that so closely linked, it does give you that opportunity to move some of that more quickly, perhaps, than other settings. But its principle and its core is, it is a healthcare delivery system. It's where patients who come to us who are sick, we try to make better. It's a place where we try to prevent patients from becoming sick.
I also read that is there a children's?
Yes, New Haven, the Yale New Haven Children's Hospital.
No, is that a separate entity?
It's part of the same license, but it is a building onto itself that is part of our campus.
Okay.
Very unique, as all children's hospitals. You know, we have two major children's hospitals in the state. This is one of those two. Specialists just in pediatrics, whether it's surgery or medicine, are all contained in that facility. And that also has that same relationship with the Yale School of Medicine.
I'm just interested briefly, Abe, in how this looks organizationally. I mean, organizationally, the way this looks, it must be the Yale healthcare system, and then under the Yale healthcare system, there must be the medical school, there's the Smilow Cancer Center, is that the way it's organized?
Not quite.
Okay.
So under the Yale New Haven healthcare system, there are three major healthcare delivery system or products in that. Yale New Haven Hospital, Bridgeport Hospital in Bridgeport, Connecticut, and Greenwich Hospital
that's right.
in Greenwich, Connecticut. The medical school is a separate entity under the Yale University. But obviously we work so closely together, but they are two separate
Okay, but
organizations.
the New Haven, the Bridgeport, and the Greenwich
Hospital are under the
So
Yale
they're
New
part
Haven
of the Yale healthcare system?
Correct.
Okay.
Correct.
It's like Hartford Hospital having something like Mid-State.
Very much.
Okay.
Very much.
Same kind of thing.
Same kind of thing.
All right. So we've got all the special programs, and we're talking net of the Smilow Center, the Cancer Center, which I do want to talk about. And give us a little bit of a sense of the scope. The scope of Yale New Haven Hospital, you said there was about 1,000 beds. How many patients go through there, number of employees?
So we, somewhere around 12,000 employees
12,000.
Are in our healthcare system, and some 50 to 60,000 admissions a year. That's sizable. That's very large. I know we're going to be talking about the Hospital of St. Raphael's.
Right.
When that acquisition occurs, we will be the 4th largest hospital in the United States.
Wow. I didn't realize that.
So we're not far from that now, but with that, it does move us into the 4th largest hospital.
You clearly have to be the largest employer in the New Haven and
second to Yale University.
Second to Yale University itself. And,
yes.
And also from reading about Yale, before we get into Smilow, there's a tremendous amount of community-based programs that you do as well, right?
Absolutely. It is our commitment. We are part of the New Haven community in every aspect, whether we're in the schools, whether we're in community with prevention, all of those. We have relationships with community programs. Our aim is to make our community, as all of us in healthcare, make our communities healthier. And that could be at the hospital or it could be in the community.
And Yale is also ranked, I think is it U.S. News World Report? Very highly ranked, right?
Most of our major programs that I talked about are in the top 50 in the nation. Some are as low as in the low teens, and some are in the 20s and 30s when you compare the top 100.
So you must have people coming to you from like all over the world, Abe.
We do. When you look at who we serve, as any healthcare organization, principally, we serve our local community and then regionally out. But we do serve patients from New York, Massachusetts, and really everywhere outside, from the Caribbean all the way out to California. This happens mainly because of the recruitment of the kind of physicians we recruit. So we recruit top-notch physicians in their fields. They tend to draw patients because they have a unique set of skills that they bring that isn't available elsewhere.
You know, it's interesting, Abe, listening to you talk just briefly. The previous guest that I just had, a panel of women from a healthcare company, do a lot of consulting work, and I bounced off them something that irritates me when I hear it, and that is that whether it's pundits or otherwise, you hear them say, America has probably one of the most expensive healthcare systems in the world, with the least with among the worst results. And I mean, I get so irritated when I hear that.
As I do.
Because you know what, Abe, I think of, it's almost like the immigration issue. I get so sick of it after a while, I keep on saying to myself, if this country's so bad, why is everybody trying to get in? And nobody's trying to get out?
Jim, it's
the same thing with medical, isn't it?
It's a very good point. We often get patients who come to us from other parts of the world because the kind of care we deliver may not be available there, or if it is available, there's such a long waiting list to receive that at times it's longer than one should wait to receive that care. So yes, you're right. You're absolutely right.
Let's talk about the Smilow. Tell me about the Smilow Cancer Center.
So Smilow Cancer Hospital, which is under the license of Yale New Haven Hospital, it's a separate entity within the license, opened just about 2.5 years ago. It's an incredible labor of love for many of us. I came from New York to head up that project.
Sloan Kettering.
Sloan Kettering, small little place in New York. And frankly, I had no reason, no desire to leave New York. Memorial Sloan Kettering is a phenomenal place to be a part of, to cancer care. I took that opportunity.